Welcome everyone to another High Yield Explainer. Today we're sending a huge shout out and an enthusiastic welcome to Mr. Koi's surgical technology students over at Pima Medical Institute. Let's jump right into this chapter exam blueprint covering the gastrointestinal and genitourinary systems. We've got a lot of ground to cover, and honestly, my goal today is just to help you master this material so you can walk straight into that classroom with absolute confidence.
We all know the stakes for this upcoming exam are pretty high. Microbiology textbooks can be, well, incredibly dense. They're just packed with endless names of bacteria, viruses, and these really complex clinical scenarios. But don't stress, because that's exactly why we're here. We're going to distill pages and pages of that heavy textbook material into clear, testable takeaways. We're breaking down exactly what you need to know, not just to ace Mr. Koi's test, but to actually be an outstanding surgical technologist out there in the real world.
Okay, here is our roadmap for today. First, the GI microbiome and oral diseases. 2. Bacterial GI pathogens. 3. Viral, fungal, and parasitic infections. 4. The GU system and STIs. And finally, classifying UTIs. Let's get into it.
All right, Section 1, the GI microbiome and oral diseases. This is our starting point. So there's actually this crazy, delicate balancing act happening inside us every single day. Your GI tract is basically a continuous tube from mouth to anus, and it is absolutely packed with microbes. Now, the key distinction you need to nail for your exam is between resident and transient microbes. The transient ones, the microbes just passing through in the food we eat and the water we drink, they're kept in check by our resident microflora, our digestive enzymes, and that highly acidic environment of the stomach. Most of our normal intestinal flora are obligate anaerobes, like bacteroids and fusobacterium. But remember, this natural balance is super fragile. A round of antibiotics that's meant to kill a pathogen, well, that can easily wipe out your beneficial resident inhabitants right along with it. And on top of that, eating excess sugars can actually feed the unfavorable microbes.
Let's pause for a rapid-fire knowledge check straight out of your textbook. For a really long time, scientists actually thought the stomach was totally sterile just because of its extreme acidity. So how exactly does Helicobacter pylori manage to survive, let alone thrive, in that harsh gastric environment? Think about it for a second.
Got it? The absolute crucial point here is an enzyme called urease. H. pylori produces urease, which effectively neutralizes the gastric acid immediately surrounding it by converting urea into ammonium ions. It's literally like the bacteria is walking around with its own personal antacid shield. Plus, it has these little flagella that help it actively burrow deep down into the mucus lining, where your immune system just can't reach it. And this brilliantly illustrates why H. pylori is so incredibly dangerous if it's left untreated. This exact sequence you're seeing right here is classic exam material, so definitely commit this to memory. The infection starts as chronic gastritis, which then progresses to atrophic gastritis. From there, it leads to intestinal metaplasia or dysplasia. And finally, the whole thing can culminate in gastric adenocarcinoma, which is a very serious type of stomach cancer.
Moving right along to Section 2, Major Bacterial GI Pathogens. Let's take a look at the really high-yield threats of the GI tract. I want you to just let that massive number sink in for a second. $1 billion. That is the estimated excess healthcare cost caused by Clostridioides difficile, or C. diff, in a single year. Back in 2019, the CDC actually ranked C. diff as their #1 antibiotic-resistant urgent threat. It's one of the absolute most common healthcare-associated infections, and it primarily strikes patients who are already on antibiotic therapy, which, as we literally just talked about, wipes out their protective resident flora and leaves the door wide open.
Now, if there is one comparison table you need to memorize for Mr. County's exam, it is for sure this one. Escherichia coli comes in 5 major pathogenic strains, and trust me, they're super easy to confuse on a multiple-choice test. So let's use this table as a blueprint. EPSC is famous for nursery diarrhea in infants. ETEC is your classic traveler's diarrhea. EHC, specifically that O157H7 strain, is a massive red flag. It produces the Shiga toxin, causes bloody diarrhea, and can lead to a really severe complication called hemolytic uremic syndrome, or HUS for short. Then you've got EASC causing persistent diarrhea in children, and finally EIEC, which causes dysentery very similar to Shigella. You've got to know these distinctions.
And speaking of Shigella, take a look at this shockingly low number, 10. That is the infectivity dose of Shigella dysenteriae. It literally takes only 10 microscopic organisms to cause full-blown bacillary dysentery, which comes with bloody diarrhea, fever, and severe nausea. The reason it's so highly contagious is precisely because it takes so little of the pathogen to actually make someone sick.
Now, for you future surgical techs, this is where the microbiology anchors directly into the operating room. If a patient experiences GI trauma or a ruptured bowel, two microbes, Bacteroides fragilis and E. coli, work synergistically. First, the E. coli rapidly consumes whatever available oxygen is in the escaped tissue. Then, the anaerobic B. fragilis thrives in that newly oxygen-depleted space, rapidly multiplying and forming really aggressive abscesses. And if those abscesses rupture, you get peritonitis. So always be prepared for what you thought was a simple incision and drainage to suddenly escalate into a massive, complex peritoneal case.
All right, Section 3, viral, fungal, and parasitic infections. We're moving beyond just bacteria here to keep our momentum going.
First up, we've got the hepatitis viruses, which are A, B, C, D, and E. Their primary target is the liver. The really scary part about these is that chronic infections can go completely undiagnosed for years until severe, irreversible damage like cirrhosis or liver cancer develops. But to contrast that kind of dark reality, let's look at something positive: lactobacillus. This is a friendly resident of the GI and female GU systems. It acts as a super helpful probiotic, breaking down food and actively suppressing the growth of pathogenic organisms.
Okay, it's time for another red flag knowledge check. When we're examining stool samples for protozoan parasites like Entamoeba or Giardia, what do we call the active, motile feeding stage of its life cycle? Any guesses?
The answer is a trophozoite. These parasites are typically acquired through the fecal-oral route, usually from contaminated food or water, and being able to identify that active trophozoite stage in feces is absolutely key for an accurate clinical diagnosis. Moving down the body, we hit Section 4, the GU system and STIs. This is our shift in anatomical focus, pivoting straight downwards to the genitourinary system. So, bacterial STIs like chlamydia and gonorrhea are incredibly common, but the real danger lies in when they go undiagnosed. And that happens a lot because they are often completely asymptomatic. For females, untreated infections carry some devastating silent consequences. We're talking pelvic inflammatory disease, life-threatening ectopic pregnancies, and even permanent infertility. Furthermore, if a newborn is delivered vaginally by an infected mother, they're at a severe risk for neonatal conjunctivitis and pneumonia. Here is an absolutely crucial OR alert specifically for your clinical practice. During an open total abdominal hysterectomy, or TAH, the surgeon dissects the cervix, which creates an opening into the vagina. And remember, that's a naturally contaminated body orifice. Even with pre-op prep, resident microbiota is still going to be there. Because of this, any instruments used for traction during vaginal vault closure must be strictly isolated after use. This completely mirrors bowel technique, and it is absolutely vital to prevent cross-contamination of the sterile peritoneal cavity. Doing this reduces surgical site infections big time. You're also going to encounter viral GU infections in the OR, specifically those caused by HPV, which is the most common STI. Unresolved HPV can lead to condyloma, which is the medical term for genital warts. Now, these can range from small, flat lesions to really large cauliflower-like growths. As a surgical tech, you'll see these treated surgically through ablation, using electrosurgical or laser energy, or sometimes through sharp excision. Finally, we've arrived at Section 5, urinary tract infections. Let's look at exactly how we classify these infections for diagnosis and treatment. Your textbook draws a really hard, fast line between upper and lower UTIs, and let me tell you, this distinction is a highly common target for multiple-choice questions. Lower UTIs, like cystitis, affect the bladder and urethra. They bring on symptoms like dysuria, urgency, and cloudy urine, but they generally respond pretty well to antibiotics. Upper UTIs, however, like pyelonephritis, affect the kidneys and ureters. These are much more severe. We're talking high fever, severe flank pain, and they can easily become life-threatening if the bacteria manages to cross into the bloodstream.
The final key distinction we need to make is between complicated and uncomplicated UTIs. Uncomplicated UTIs typically occur in otherwise healthy individuals. They're often caused by the gram-positive S. saprophyticus, and they're usually pretty easily treated. Complicated UTIs, on the other hand, totally different beast. They involve mechanical issues, neurological problems, or incredibly tough antibiotic-resistant pathogens. The absolute most vital takeaway for you here? Urinary catheterization is a massive risk factor for these complicated, hospital-acquired infections. So, I want to leave you with this final, somewhat provocative thought. As you review your textbook, memorize these lists, and really prepare for Mr. Koi's exam, remember that mastering this material isn't just about getting a passing grade. Every single time you step into the OR, you are the ultimate defender of the sterile field. If you break sterile technique and cause a surgical site infection, which of these terrifying microscopic pathogens will you be answering for? Know your bugs, guard your field, and seriously good luck on the exam. You've got this.